Rutland Regional Medical Center was the venue for the Affair of the Heart event this past Wednesday. The event showcased resources for Rutland heart health in the Rutland County community. One presenter, Dr. Coleman, spoke with community members about the evolution around hypertension.
We spoke with Dr. Coleman after his presentation on hypertension, more commonly known as high blood pressure, to find out just what concerns, questions, and hopes lie around the evolution of this heart disease.
So my goal today was to address the issue of hypertension and the changing landscape that we're all experiencing over the last 4 or 5 years, mainly because the guidelines are shifting a little bit based on some new data that we're getting. So I ended up bringing up the point of what is hypertension, trying to describe it to our patients, and then also bringing up the issue of the way that it has been evolving over the last few years.
The landscape around hypertension has shifted, leaving some patients worried and confused.
Ultimately, in 2014, they came out with new guidelines, the Joint National Committee guidelines that essentially were very similar, but what they did do was they increased the hypertension goal for people over the age of 60. And that sent a lot of shockwaves around the medical community because we had been so aggressive with blood pressure control, but the JNC's point was, well, when they looked at the data, they recognized there was not a lot of information to suggest we were benefiting patients. And there was concern that we were over-treating patients in the elderly population. So ultimately, what happened was it created a lot of discussion. And so some of that discussion naturally spilled over into the patient rooms, and patients got a little confused. So I've been seeing in my own clinic, my own practice, a lot of questions about, well, why does my primary say this, and why are you saying that? And so I felt that it might be good to address that today, and that's what was the whole point of the talk.
For additional information on Dr. Coleman, visit the site on your screen.